Good evening and good to have you with us in this edition of the Urban Debate. Viewers, here on Mirror Now, we've been constantly telling you to not let your guard down. We've been constantly questioning the state authorities wherever we've seen a large number of lockdown violations, wherever we've seen the authorities not implementing rules on ground, people not following rules on ground. And there is a reason why we've been saying that. Simply because the COVID pandemic is not over. We may be unlocking, but the virus hasn't gone away. In fact, we are still discovering things about the virus itself, which is why it is very important for us that the effort we took over the last 3 months when we were in a lockdown, that the effort and the sacrifice that we made for those 3 months when we were completely in a shutdown mode does not go waste. Tonight, I bring to you data as a continuous exercise that we've had here on Mirror Now with the India Outbreak Report in association with Protiviti, and this data should send the alarm bells ringing in your own mind, should give you a sense that you cannot let your guard down. This data is reflective of the fact that the minute we open up and we begin to step out of our homes, the cases will go up. Now, to what extent are we all right with that is a big question. If the number of cases, active cases, go out of control, can India's infrastructure, the healthcare system, really take on that kind of a burden? Remember, the battle for us is very different from what it is for any other country in the world because we have that high density population. Now, as I present to you the latest projections as per this India Outbreak Report, let me first tell you what the key headlines are. The projections show a stark rise in cases. The peaking of cases that was earlier around July, first week to end week July, maybe in some cases August, has now gotten further prolonged, further delayed for most parts of the country, which means that there are more and more cases still coming out, and the worst isn't over for a lot of big cities in our country. Not only that, the initial projections about a month ago showed a peak for India around 2.5 lakh cases. That's now jumped and more than doubled as a projection. And that's a big jump that we're going to sit and analyze today with the help of data and our experts. The other big headline is the steep surge in cases that's coming in from the southern states. Yes, the states that were actually doing well in the first part of this lockdown are the ones who are witnessing a worsening of the situation, a big deterioration. And we will get you those breakup numbers. Karnataka, in fact, for example, is projected to now see 53,000 cases by August 4th. Very different from what the situation was just 3 weeks ago in Karnataka. The situation is stabilizing in Delhi, in Mumbai, and in Gujarat. The places where we saw a big challenge last month and the authorities clamped down, rules were strictly followed, are the ones that seem to be seeing an improvement now. Pune and Thane are still the big challenges in Maharashtra, unlike Mumbai. Of course, cannot let our guard down anywhere. Delhi seems to have crossed its peak point, provided, of course, the situation doesn't change drastically because of a third factor. The doubling rate is increasing even now for states like Maharashtra, Rajasthan, West Bengal and Gujarat. So yes, they seem to be doing something right. It's taking more time now for cases to double there. The doubling rate is falling in Telangana, Tamil Nadu, Andhra Pradesh and Karnataka, which means that the cases are doubling there faster. It's not a good sign. These are just the basic overall headlines. We are going to break it down over the next 1 hour, so you stay with me to find out how your state is doing, how your city is doing. First up, I actually want to go across to the man who's actually been heading this exercise, Dhrubo Ghosh Dastidar, Director for Data Analytics and Digital Transformation at Protiviti India is joining us right now. And Dhrubo's been doing this exercise with us for several months now. Dhrubo, let's begin with what really caught your eye when you were putting together the data this time versus, our previous exercises that we've done. It's starkly different, but what caught your attention? Dhrubo, we seem to have a problem with your audio line. We're just going to fix that and we will come back to you in just 30 seconds. Okay, I believe we've got the audio line through now. Go ahead, Dhrubo.
So I am saying that for us, when we looked at the data this time, we saw the effect of unlocking, right? For the last number of reports or waves which we ran, we have seen the effect of lockdown. And we have seen how well it can control the increase in the number of cases. However, this time when we looked at, we saw the effect of unlocking very badly in the southern states. Now, if you look at the northern states versus the southern states right now, you will see that the table has turned. What was the case a couple of months back in the central and the northern part of India is now where the southern states are, and vice versa, right? So that definitely has caught an attention. The other thing which we have seen is the pace at which this can rise when we are in the unlocking period. Take an example of Mumbai and Thane. Mumbai at its peak was 29,000 cases in 1st of July. When I say peak, I mean active cases. Whereas in Thane, we have seen a growth to 30,000 cases within a very short period of time. Same goes for Bangalore, right? It grew from 200 cases to 7,000 cases in a very short span. And that, as you rightly said, puts a strain on our infrastructure. That's something which we have observed. What we have also observed is the states like Uttar Pradesh, Madhya Pradesh, they have started doing much better as compared to last time. What we measure is with the R naught, right? The reproduction number. That has significantly gone down for the northern states. And unfortunately, it has gone up for the southern states. Gujarat, West Bengal, Maharashtra is kind of in the middle. The epicenter keeps on changing from one state to the other as well. So initially, in the early days, it was Bombay and Maharashtra. It moved towards Delhi and then towards Tamil Nadu and Chennai. And somewhere it's in Telangana and Karnataka right now. So that's also a cause of concern for India overall, right? So once one of the states does better, the other states kind of seem to do a little bit worse and starts getting into the rising mode, right? That has been our main concern with this pandemic. Another thing which we have observed is compared to other countries, we tend to keep at the same growth rate for a much, much longer time. So if you look at the 7-day moving average of our growth rate, we are still around 3.5%, which is not mostly the case with most of the countries. So once you cross a certain recovery, the growth rate falls drastically, which is not the case for India. But still, we see a lot of recovery happening. We see the mortality rate also on the lower side. So that's also something which hasn't changed drastically for India. We were at a lower mortality. We still continue to be there. So these are some of the factors I would say, Tanvi, we have observed from these from the last time we ran the report and this time.
Okay, Dhrubo, the other thing, as we bring out this data, what everybody wants to know, obviously, and which is why state-wise and city-wise we are breaking it for them, because everybody wants to know when will it end in my city, when do I get to go out. But the other thing is, how are we faring? Is there one statistic that we can take away as a sign, a positive sign and a ray of hope?
Two things. We are a country where our number of cases by number of tests run is somewhat on the lower side, which means that the positivity ratio is lower as compared to many other countries. So that's a good sign. Our mortality is also a bit on the lower side, which is also good. What we also should look at the recovery rate going up and staying up. What we have observed for a lot of these states and cities which we are monitoring, the recovery rate goes up and then it starts tanking down, which is a problematic area, right? And I would keep a watchful eye on all the states which are now at a very high recovery rate. States like Uttar Pradesh, Madhya Pradesh, and a very low reproduction number. It shouldn't start falling down. If it starts falling down, that should be an early warning signal for us to put a check to that, which didn't happen, unfortunately, in case of the southern states. When the recovery rate started falling and the reproduction number started going up, we should have perhaps put a check there itself. So yes, certain KPIs or certain key parameters needs to be monitored on a regular basis and ensure that we take steps earlier than later so that we can put a check on the disease itself.
Dhrubo Ghosh Dastidar, thank you so much for joining us and putting that in perspective as we now present the data that you and your team have mined for us, and it's so helpful for people, for authorities. Everybody needs to take a note of this, because this is essentially showing the result of how we fight coronavirus, how we conduct ourselves, whether we are following rules or not, whether we're doing enough to crack down to limit the spread of the infection. And this is the data that tells you all of those stories. So let's begin. First up, I actually also want to bring to you the 10 states where the cases are likely to peak first. Now, this is as per the data that the governments put out, the state governments put out, and then we use that in our projection model. And as per that, here are the states who may see peaking than other states. Maharashtra likely to see a peak now by 1st of August. It's changed. It's pushed forward significantly as cases rise in outside Mumbai in districts like Thane, and Pune continues to be a problem. So by August 1st, Maharashtra is likely to peak. Karnataka is the other one. Was doing so well initially, and now its peak date has moved to 8th of August with roughly about 53,000 projected cases. Tamil Nadu is likely to peak sooner than these two states, so say by July 20th, and roughly the same amount of active cases as Karnataka, around 53,000 at that point of time, and then the number of cases are projected to begin to come down. Andhra Pradesh is likely to peak by August 16th with about 34,000 cases. Now remember, viewers, these are active cases. New cases will keep adding, but if the number of recoveries are higher than new cases, that's where after this point your active cases will begin to go down. Then you have Uttar Pradesh, which is likely to peak around August 18th with about 34,000 cases. Delhi, in fact, Delhi has already peaked. So all of those, strict measures that the centre and the Delhi government took, the entire debate and conversation and crackdown that took place in June, as of now, it seems Delhi may have seen its worst already. Now, unless they let their guard down again and cases begin to go up again. Delhi peaked on June 27th. Telangana by July 30th. Gujarat by July 22nd with about 10,000 cases. Kerala by August 10th, so there also it's shifted a little with about 4,300 cases, but the number of cases are still lower. And Haryana has also already peaked, but they cannot let their guard down. So this is as far as the 10 states are concerned. Let's quickly start our conversation with the state of Karnataka. Here on Mirror Now, we've told you again and again in the last 3-4 weeks that something seems to be going wrong with the Bengaluru model and in the state of Karnataka, to the extent that even now the authorities and the government is accepting that yes, suddenly they're looking at a huge spike. These are the big takeaways from the charts that are on your screens right now. The situation is actually worsened from June 14th to now. The peak has now shifted by 42 days, which means, and it's also gone up. It's supposed to peak with about 53,000 cases now. And the R0 rate, viewers, which is how many people can one person infect, which shows the extent and how quickly the infection is taking place, that has gone up in the state of Karnataka from 1.42 to 1.62. So this is also a very important statistic that most experts look at, your rate of infection spread, which is the R0. And as it goes up, it shows a terrible picture. Let's say good evening to the panelists who are joining us for a conversation on Karnataka. Mr. Vivek Reddy, spokesperson for BJP in Karnataka. Dr.Sylvia Karpagam, public health doctor and a researcher joining us this evening. Mr. Reddy, what happened? Suddenly, just in the last 1 month, how did Karnataka lose control over this?
Well, I think during such time, Tanvi, the lockdown was there. The government did an excellent job in order to curtail the spread of this pandemic. Even thereafterwards, the government has continued its old practices. But I think the intense economic activity that Karnataka, or at least Bangalore, is known for, is a cause for the spike. And you see that all around India, wherever there has been intense economic activity, that's where there's been an escalation, and that's where there's been an intense spike. This is one aspect. The second aspect is, of course, what is surprising for us from the side of the government is, since the past 1 week, there's been a terrible increase. I think this is where the government is gearing up for the challenge. Every city, every major cluster in the world is facing a peak. And I'm thankful that you analyze the peaking dates. I think now the big challenge for the government is to target and face this challenge of peak and ensure that it is minimized. Government also considered whether there has to be a lockdown at this stage. But then they resisted, they thought otherwise, and they thought that let this activity continue. Perhaps the government may have a rethink in the days to come. This is how the things are going in Bangalore. Massive preparations are being made with about 10,000 beds being provided in order to ensure that people can come in. Home quarantine rules for the asymptomatic patients or mild symptomatic patients have been declared. And government is working at various levels to ensure the effect is minimized. But as you said, it is still surprising for us that there is a peak within the past 1 week. We see a lot of case increases, escalation. And this is what is surprising for Bangalore. It was hoped that the people of Bangalore ensure that there are safe practices in order to fight this challenge, and so that we can all come together to ensure that there is a minimal effect.
Okay, but Mr. Reddy, one question that will be on minds of everybody in Karnataka right now will be what happens next? Will we see stricter rules or like it has happened in several other parts of the country where we've gone back to a lockdown or a shutdown? Is that something that will be required based on your own internal analysis as well? Like you said, the last 1 week, the spike has been very concerning. So as the state now prepares and brings in additional beds, adds to containment zones, puts ministers in charge of smaller regions to personally track all of that. As all of that happens, is there a possibility that people should brace themselves for stricter rules or a lockdown?
I think the government is exploring all options, Tanvi, at this point. The question is when this will happen. But if things go out of control, or if the peaking or the spike in the cases is very steep, then I think the government will consider locking down in order to prevent the spread of the pandemic and to flatten the curve. I guess that at least is an option that the government is exploring. The question is when it will happen. But the government is, as far as possible, the government is trying to avoid such a situation, because the question of livelihoods are also posing a challenge. The millions of people are on day-to-day livelihood. So therefore, it's a balance between the two, and they are seriously considering it.
Okay, just some other statistics that I want to bring to the notice of our viewers. And like I said, viewers, R0 is a very interesting statistic that shows you just how quickly the infection could be spreading. Now, as of 20th of April, the R0 in Karnataka was 1.66, but by 14th of June, it had gone down to 1.42. It's now gone up again to 1.62, which is not a good sign. R0 is essentially how many people can be infected with one active case, and this is what experts traditionally track very, very closely, apart from, of course, the active cases and the recovery rate. Let me bring in our expert as well. Dr. Sylvia Karpagam joins us on this conversation. Dr. Karpagam, we were talking about this a couple of days ago as well. What is it that Karnataka needs to do immediately to now contain the infection and ensure that things don't worsen Right now, our projections show that it could, the number of cases could peak and hit as high as 53,000.
Hi, Tanvi. As we discussed earlier, I think there is some kind of a misunderstanding about what a lockdown is. A lockdown definitely leads to a lot of disruption of people's livelihoods and economic activities, and it should be the last option. And the only reason any state would decide to have a lockdown is to prepare. So that in terms of either preventing the cases from becoming more and more infective and in numbers increasing, and also in terms of anticipating the kind of emergency or crisis that is likely to arise. And the government of Karnataka had an almost 1 month lockdown, and now they're suggesting a lockdown as though it is a responsibility of the people. But the problem is that during the last period of lockdown, the systems have not been prepared, and it's not that now that the cases are rising, you say we will do this and we will set up systems and we will identify cases and set up health facilities. So clearly there's been a delay in responding, in anticipating and in preparedness. And I think this is not a surprising or unexpected turn of events. That is one thing. And if one has to now do something to do interventions, I think there are two things which the government can really work on, and that is to make sure that more and more people don't get infected. And the other is that the serious patients have access to emergency care and are not denied any health care for whatever reason, whether it's economic reasons or social reasons. And there are already models that are available for people who are positive. It depends on their comorbidities, whether they have other pre-existing conditions and whether they are at high risk. It also depends on their socioeconomic condition. So if a person has the ability, there are hardly any messages going out to people that you can self isolate at home. Initially there was a lot of confusion. People thought, like, if you're positive, then you have to rush to a hospital and occupy a bed, wherever you can get it. And that message still hasn't gone out clearly. I think the message has to go out that 85% patients do recover. If a positive diagnosis doesn't mean you have to panic. You can stay at home. And I think we have a lot of areas in Bangalore which are lower socioeconomic areas where definitely people cannot self isolate. And for them there should be facilities like fever clinics, and these have to be well equipped. We also haven't yet explored the idea of reverse quarantine, which is very important, which is at all people, like if they have comorbidities and if they're high risk, they're given the public health, education that you can go to these centers. These centers can be any like places with single rooms, like medical colleges, schools, hotels, lodges, and people should be able to do reverse quarantine there. And we also this whole issue became highly communalized at the beginning, sometimes deliberately to take the focus away
Correct.
from the government's responsibilities. So there is going to be a lot of caste and class and religious prejudices that are going to come in. People from dominant caste will say, I won't stay in a hotel where there's a Dalit or Adivasi person. People from Hindu community may say, we don't stay with Muslims. So I think those have to be addressed. You have to go on a seriously address those concerns of people, and tell people that in a pandemic like this you cannot have prejudices, because that's going to prevent even whatever the efforts the government is going to make. And the other point I want to make is, this focus on Bangalore is artificial. The other districts are very vulnerable. People who have come from different states, the migrant workers, have possibly carried infections and possibly moved across communities. It's very important that there's preparedness across the state. It can't be very focused only on Bangalore or only on the city. And if I think in terms of the emergency care,
So, Dr. Sylvia, very quickly, let me ask you this question, Dr. Sylvia, because if I can just come in there, because you made this point, and I largely agree with you that lockdown wasn't simply to protect ourselves as the virus goes away. It was to help our governments and authorities prepare better, build their policies, their health infrastructure, get a grip on the direction forward, and then we start unlocking. But there are many now who are asking questions if Karnataka should have held exams and let the youngsters out, go them in the middle of the pandemic. There are many who say, well, look at Bengaluru, they opened up their restaurants, allowing people to sit and have food way ahead of everybody else, and that should not have been done. Do you believe that there is a possibility that we continue to unlock like that while we are ready with enough number of medical staff, enough number of beds and ventilators and awareness amongst people to handle if the cases go up?
Absolutely. See, this whole response to a pandemic has to be participatory. It cannot be done in a punitive manner where people are treated like criminals and, they're told you have to stay at home if you don't have money or if you don't have food or if you don't have access to healthcare. The government, when it says a lockdown, it means the government in principle says we take over these responsibilities. We will ensure that you have food, we will ensure that you have a livelihood, and we will ensure that in the case of a crisis you will have access to healthcare. So with a lockdown, just punishing people means nothing at all. And when unless the government takes a responsibility with or without a lockdown, it's going to make no difference.
Okay, here is our expert saying that, simply going back into a state of lockdown is not really the solution. Significant amount of, discipline, I believe, is also required. We do need to keep in mind the economic impact, the livelihood part of it, while we ensure that whatever rules are there are actually followed well. I am going to, thank both of our guests as far as Karnataka is concerned, but for Karnataka viewers, just to reiterate, the challenges are manifold. Unfortunately or fortunately, because in the first few months, Karnataka did such a, relatively better job than other states, and the cases were extremely low, and that's visible in the way it's suddenly peaking now. If you look at the chart for Karnataka cases, they didn't even prepare too well. They didn't have enough number of beds and hospitals, a centralized system for allocation of beds, a helpline system for a supply chain system for medicine. All of those issues that a Mumbai or a Delhi actually saw a month and a half, 2 months ago is something that Bengaluru is beginning to look at now, which is unfortunate. We should have learned our lessons from other states and other cities, and we should have prepared ourselves better even if the number of cases were low. It's happening now. Let's hope that the government is able to ramp up fast so that the struggle and the pain for the patients isn't that much. That's as far as Karnataka is concerned. I'm going to quickly move on to the other big state, the other southern state, which for a while now has been a concern. And for Tamil Nadu, it's a mixed bag. It continues to be a concern with cases on the rise. They've already, gone into a shutdown mode for multiple districts. There are complete lockdown days in Chennai and then other relaxation days. There are 6 other districts that actually saw a 15-day lockdown period in between. All of this is only happening because there's been a sudden spike again. Unlike the northern states, Tamil Nadu did not see too much of a problem in March or April, but it did in June and even now. So here is what the data shows as far as Tamil Nadu itself is concerned, that the peak is projected to be delayed by about 15 days. Total number of cases on a peak date are projected to be around 53,000, similar to Karnataka, but the peak date has actually moved further ahead by 15 days. The R0 is largely being like a flat curve, so that's not really changing too much. And the doubling rate, which is, how quickly are the number of cases doubling and how many days does that take, that seems to be stabilizing, but it's not really increasing, which is what it should be right now. These are the basic numbers and statistics that we've got. Of course, if I just specifically tell you about Chennai, which has been one of the pain points for Tamil Nadu, Chennai is projected to peak and then the peak was 5th of July, and then it's supposed to start coming down. So maybe for Chennai, we are already in that turnaround period. For some of the other cities, that may not be the case in Tamil Nadu. But it is still likely that Chennai continues to see over 1,500 cases even by September. And that's when it will begin to come down significantly. Let's say good evening to the panelists who are joining us as far as Tamil Nadu is concerned. I've got Mr. V.A. Pugazendi, spokesperson for AIADMK, joining us this evening, and Arun Ram, resident editor of Times of India, Chennai. Mr. Ram, let me begin with you. What do you think really happened as far as Tamil Nadu is concerned? Lockdown in so many districts after the rest of India had begun to unlock. Was it that people were not being careful enough, or the authorities were not implementing the rules properly?
No, I think Tamil Nadu woke up to this challenge, to this reality that COVID is knocking on its door very late. Because if you remember, the neighboring state of Kerala registered the first case of the medical student who came from Wuhan, and soon followed by her friend. But those days, I still remember that the health minister, the health secretary, and all these officials were sitting pretty. They thinking that some invincible force was protecting them from the neighboring state. Even when diseases experts have been warning the health officials that any time Tamil Nadu could be sitting on a time bomb. So I think the problem with Tamil Nadu was that it tried to ignore the threat which was clear and present. I think the second wrong thing the government did was not being transparent. I've been saying this for a while. Even when there were a large number of cases, we know for sure that some of the government hospitals were instructed not to register them as COVID cases. So somehow it was the Tamil Nadu government was trying to wish it away, thinking that it would just go away in a very Donald Trump kind of a way. They paid a heavy price for it when two clusters, not one, burst in Chennai, one being the Tablighi Jamaat cluster of what we call the export cases from Delhi, Nizamuddin. And the second one was a much bigger and a less contained cluster, which is the Coimbatore, the vegetable flower market cluster. So once these two bombs burst, I think Tamil Nadu started acting, but then it was too little, too late. So these were the lessons probably Tamil Nadu learned, but then by the time the numbers were in thousands. Till recently, Chennai and rest of Tamil Nadu, we were seeing like 4,000, 5,000 cases every day, when even 100, 200 cases in some of the states were giving the shock, sending shivers down the spines of people in Kerala and even Karnataka. It's another thing that now there is a role reversal. Karnataka is speaking when Bangalore is speaking when Chennai is coming down. So it seems that I don't think that Tamil Nadu or Chennai have learned many lessons, but I think the virus has run its course now, and it has to peak and it has to come down. If you look at the graphs of wherever the epidemic, the pandemic had peaked and come down, maybe the crest and the trough might be different, the shape might look different, but the pattern is the same across the globe. In Wuhan, if you see, it has gone up, and with an iron hand, the government brought it down by keeping everybody indoors. That could not happen in Chennai. So off late, I think in the last 3 to 4 weeks, or probably a month or a month and a half, the last set of lockdown for the last 16 days have been effective. And I think the numbers we are seeing now, 1,300, 1,400, maybe partly because of that lockdown. Now, again, the reopening of the city, again, the results of which we will know maybe another 5 or 7 days from now. But I feel that there is already community transmission and we cannot wish it away. That is something the governments just refuse to accept. I think if the curve is going to come down and we are going to hit in hundreds by September, it is because the virus has run its course. We have developed herd immunity thanks to community spread.
Okay, fair enough. In fact, let me ask, AIADMK to respond to that. Mr. Pugazendi, do you want to respond to what Arun Ram here is saying, that, in the initial days is where we may have actually lost control of this battle?
Good evening to Mirror now. He's nicely reported this, Arun. I don't know. That he wants to tell the facts also, madam. The 15 lakhs tested was over. The highest in India, kind of information. Compared to other states, 15 lakhs crashed now tested. When testing increasing, this is also increasing this. positive cases. So once that Madras showed only 36, the upcountry 6 or something, totally 42. It was the stage. What you are asking is the correct. So now it is increased a lot. So now then we are seeing now past 4 days after the third time lockdown from the Chennai. So now decreasing the now 1,800 odd 4 days before, then 1,600 odd, then 1,400. Today excellent 1,000, nearly 1,200 something. This is the result we got it. Here it is very clear, madam. I am now saying this. It's combined responsibility of government and public. It is very, very important. Both door to door, we are going testing. So our ministers and all health officials on the road, because of that, 4 ministers infected, all positive. Today they are in the hospital, I believe or not. So day and night, the Tamil Nadu government is working, controlling the death toll. Kind information compared to Maharashtra, compared to Delhi and other states, we are very less kind information. But you are seeing that
No,
active
that
cases
is true, Mr. Pugayandi. You've not heard what I said initially. I said that. In fact, even the rate of infection, which is measured with R0 as a statistic, has improved for Tamil Nadu. I said that. Your doubling rate has stabilized. It's not increasing, which should be ideal, but it has stabilized. Yet there has been a significant jump in cases. I mean, for a fact, we can see that in Tamil Nadu at 1.6 districts went back into a lockdown because there was so much of a jump in cases. Even now, in many parts, people are not following the basic norms. My question to you is, are you saying the cases have only jumped because of high testing and for no other reason?
No, high testing, not only that, but my friend told this Coimbatore, one of the market suddenly opened, people gathered over there. Like that is not correct, because that opened the market because of the lockdown. One day we opened the market is correct, but we have not invited the people. So much people come over there and you join there like that, madam. That is unfortunate. The people rushed there, unnecessarily crowded over there. Not only that, this is very clear, asymptomatic carrier. There someone bring and positive someone, we don't know that. This is the thing going on. Now only the 4 states, Chennai, Chengalpattu, Tirupati, Kanchipuram, Madurai and Tiruvannamalai. Except that, other states are showing only single digit, are you believe or not. Only these are more, the 5-6 states. If you bring control, then automatically we will be able to control. But we cannot say corona effect so many ways. It is going on now, how spread, airborne and everything is going. Now they are telling. These things are going on. Not only that reason, you are correct. So many reasons are there. People also reason for that. We are advising, we are teaching. Everything is going on here. Every tested centers in Tamil Nadu. Tamil Nadu more we are having. The beds we are having. Everything we provided, arranged, food. Someone mentioned from Karnataka, economic things. I am telling you, we are nearly 7 lakh to 10 lakhs people getting everyday food. Food arrangements also one side going on. Ration also we are giving. Another 3 months people is getting the rations and everything. This is the thing we are controlling. We are working. This is the result we are giving.
Can I add something?
Okay, Mr. Aruna wants to come in and make a point. Go ahead, please. Yes.
No, I think the mistake we are making here, Mr. Pugayandi, I think nobody is holding the government guilty of having unleashed the novel coronavirus. I think this is a mistake sometimes the media makes, sometimes politicians think that, if I show you the numbers, now I will be held, I'll be in the dock. No, that's not the way. I am putting you in the dock. I am holding you responsible. I'm pointing a finger at the government for not giving out the statistics when they are there. In fact, the Times of India has done not 2 but 3 stories with numbers, with names of people who were dead. 214 of them, we had their case sheets, the death certificates, in which the reason of death has been written as COVID-19. But still, it did not make its way to the COVID death registry. So this is utter lack of transparency. We are not saying that the government is responsible for the death. All we are saying is own up. Just hold a mirror to society. Say that we have a big problem at hand and together we have to help. And of course, all credit should also go to government and people on the field, with people, the field workers especially. I think the positivity rate has come down drastically from about 25% last month to almost 12% today, as I look at the statistics. And now doubling time has gone up
Yes.
tremendously. You know, a place called Rayapura, which was 20 about 2 weeks ago, it's 57. It's fantastic. But as I said, this is partly the credit to the government. Of course, nobody is going to grab the credit away from it. And only the reason why I'll come back to the point that the virus, as we understand it, the novel coronavirus, also seems to have run its course. It has had a threshold of number, the critical number of people where we have started developing herd immunity. I think that is where it's also going down. Of course, it's no reason for us to drop the guard, no reason to put a gun onto the government's head. But together, again, we'll have to fight it out. But own up, please own up, please be transparent so that people will be more aware and we can fight it together.
Oh yes, absolutely. In fact, Mr. Ram, though, for the point that you made about the positivity rate, just today we had the ICMR speak on it, and they said, well, the positivity rate often comes down because initially governments are only targeting the symptomatic patients and testing there, and then when you do a larger, when you scale up your testing and then you test a larger population, it automatically also comes down. But yes, as far as the doubling rate is concerned, there has been significant improvement. So there are some things that Tamil Nadu, with its strict lockdown in the last few couple of weeks, has done right, but we cannot let our guard down. That's the lesson we are seeing in many cities where we did open up and people didn't follow the rules, and the onus also is on the people to ensure that that happens, because if you don't follow rules, then the number of cases will come back. And then there may be a possibility that your state authority or your city authority decides to go back into a state of lockdown, which is not really something that any of us wants right now. Mr. Arun Ram, thank you so much for joining us. Mr. Pugayendi, thank you so much for speaking with us and responding to our questions on Tamil Nadu. Quickly moving to the state of Telangana. The state of Telangana has seen a lot of controversy about transparency in data, whether the government is being honest enough about what data is being put out, what's the true picture of number of cases, why is it that the testing was so low for the longest time. But now Telangana has also begun to ramp up its testing. More labs are being allowed, more hospitals are being included. So there are some steps that the government has taken as the cases began to rise in the last 1 month. Here is the takeaways basis our own projections for Telangana, that the increasing R0 is a worrying sign even now for the state of Telangana. While other states are seeing improvement, in Telangana, R0 is actually going the other way around. In fact, it was 1.2 in the month of May, around May 27th. As of July 7th, it's gone to 1.42. To reiterate, R0 is a reflection of how many more people can one active case, can one infected person further infect. And that really shows you how much the infection is spreading and how quickly. Also, Telangana's rise on a daily basis is putting some amount of burden on the healthcare infrastructure. So that is something that needs to be watched out for. Its peak date is likely to be July 29th. It's likely to hit about 20,000 cases by July 24th, and then by 24,232 cases by July 29th, and hopefully after that the number of active cases will begin to come down, which means there will be more people who will be recovering than the number of fresh cases that the state sees on a daily basis. Let's say good evening to the panelists who are joining us. Mr. Sriram Karvi, resident editor of Deccan Chronicle, and Paul Marks, national media spokesperson for TRS. Let me go across to Mr. Sriram first. Mr. Sriram, give us a sense of what's changing on ground in Telangana now. What is it that you read from these numbers and basis what you're also seeing on ground?
Tanvi, when I saw the projections you made, I felt very relieved given the somber, despondent mood there is in Hyderabad and Telangana right now. If your number hold true, people will be very, very, very relieved. What has gone wrong in Telangana from the word go? If I may describe their strategy, it's been maverick, a kind of Witherspoon, counterintuitive. First thing is they showed a very, very asinine kind of obduracy, if I may say so, about testing. They said, if you don't test, nobody will catch coronavirus. That was the mindset. You rightly pointed out that there is a great emphasis. Early days, maybe there was a sense of premium on kits, on utilizing it well. So there was a lot of clinical, attestation being done before you used diagnostic approach. But basically, the government of Telangana has refused to test. They would not refuse asymptomatic people. They would not refuse relatives and family members of those who have been found positive. They refused to test the dead. And as a consequence, the containment management collapsed. Hyderabad had many zones. They kept changing it. It was a colony, then a street, then a building, then a flat, then one room in a house, etc. The entire concept of contact management collapsed. All this is because of some larger fault lines in our polity. One, Telangana, which has about 4 crores population, about 1.1 crore live in Hyderabad, greater Hyderabad area. So it's one city that's more than 1/4 of the state. So the city is very crucial to the health of the entire state. For 10 days ago, the chief minister, the office announced to the media that they'll announce another lockdown because the cases moved from 500 a day on an average to 1000 to 1500 to now we are at about 1800 to 1900. And don't forget, at 25% positivity rate, nobody believes that these numbers reflect reality very well for a number of reasons. The biggest one of which is the government is refusing to be transparent. A case in point, the neighboring Andhra Pradesh has tested over 1 million people, nearly 10 times more that of Telangana. And it's not a case of financial resources. Hyderabad has been called the healthcare capital of this country. We used to plan for medical tourism where patients from Africa, Middle East could come and get surgeries done. This is the kind of city we are talking about. The decisions of the health ministers to say one government hospital is where everybody will have to go. It put immense pressure on that hospital. You did not prepare other hospitals along lines of COVID, non-COVID. So as a consequence, what's happened, anybody who's not suffering from coronavirus, but something else, heart patients, lung patients, they have no healthcare access. Today in Hyderabad, with all the money you have, you cannot get into a private hospital without recommendation. They talk about creating a world-class infrastructure called TIMS, which was an existing building. The first doctor has not seen the first patient in TIMS. The home minister is unwell with coronavirus, with some of his family members. He's joined a private hospital because he doesn't trust his own government's world-class hospitalization. They've done flip-flops on private labs. They've allowed labs to test. They see the numbers go up. They're playing this very bizarre race in their mind of saying somehow Telangana should be the state at the end of this corona epidemic with the least number of cases, no matter how, be it in lack of transparency, be it cheating, be it fudging numbers. The template on which they report has been changed 17 times in the last 50 days. And may I say, this is a state where the citizens, for the last 10 days after they said they'll do a lockdown, which instantly meant a lot of people left from Hyderabad, went to the districts and villages, and the spread of the coronavirus in the villages has gone up. This is a state where people are asking, where's the chief minister? The government seems to have relinquished, and the governor seems to have in de facto taken charge of this government. That is the kind of failure, unfortunately, Telangana has become in this fight against COVID in the last 100 plus days.
Well, Mr. Sriram, very clear, sharp points that you've raised right now. And I think the numbers are a reflection of some of those points as well and those reasons as well. So let me ask Mr. Paul Marks. Mr. Marks, what's going wrong? Is it that you were simply refusing to test earlier or give us the data earlier? But why is there a sudden jump now?
Yeah, good evening everyone and good evening Mr. Srinivas Garu. So what I am saying is, as the figures you have projected, I agree, there are some mishaps from the government, but it doesn't mean that we are not doing anything regarding the corona. So whatever we have done in the past, we have ramped up the COVID testing. So before it was hardly 2,000, now we have increased to 6,000 to 7,000 COVID testing in the state. the surveillance system is in place now, and we are taking all the containment measure. You see, out of 7,000 cases which are reported now present in the state are in the containment, and we are giving proper care to these containment persons. And apart from this, we are also taking measures to go for the hospital preparedness. So in fact, I agree with you, like there are some loopholes in the state and government hospitals where the problems are the doctors themselves are not coming for the screening, they are hesitating. So we have to increase their morale so that they doesn't leave the corona patients, because in the past you have seen many patients making the selfie video of the infrastructure that is present in the government hospitals. So that we are taking proper care, and we are motivating them with the constant workshops or the increased awareness among the doctors. So that care we are already taken off. And as you are talking about the central government or the efforts and the state government efforts, so we are on par with the central government what it is directing, and we are on par with the ICMR guidelines. It is not that we are not onto the par of the ICMR guidelines. We are giving proper care round the clock to the right person, and with the right care. And and if you ask me personally, what I opine to you is, see, the present situation, the magnitude with which the corona is striking you now is far exceeding the state efforts, any state government efforts, and Telangana government is not an exception to this. So you have to understand the present
No, no,
magnitude of the
no,
COVID
no,
striking
Mr.
us.
Marks,
So
Paul, you
yeah.
are highly mistaken there. States like Delhi, Gujarat, Maharashtra are actually have managed to get quite a grip on this situation. Delhi and Gujarat have seen quite a bit of a turnaround. Mumbai has seen a significant turnaround, even if other cities like Pune and Thane continue to be a challenge. So it's not to say that everybody is going through the same phase. Karnataka, which was doing very well, has suddenly now seen a spike because they let down their guard. In Telangana, everybody seems to be asking this question: where is the government and where is the transparency in what's going on?
See, as a government, our responsible. Where is the government? You have asked me. It doesn't mean that we need to address to the media regularly, and we need to portray ourselves that we are doing much care, because our actions speak more than what words we tell to the media. So we have. It is not necessary to gratify all the criticism we are getting right now, but whatever loopholes were there in the past, that we are trying to rectify it, and we are taking care to give good care to the patients. That present we are doing now. And as far you ask me, like what is the state government doing in the state run government hospitals, and like why the state missionary is going to the private hospitals for the treatment. So I'm telling you that in fact, if you understand the present situation, there is panic among all the citizens that if they go to government hospitals, they uh, will worsen their condition. Their condition will become more critical if they are coming in contact with the COVID patients that is presented to the government hospitals. And if they are by chance going to the private hospitals, they are looting
So
and
that is
exploiting.
absolutely true. That is
Yeah,
absolutely true. We highlighted repeatedly what has happened in one of the biggest hospitals in Hyderabad, the kind of chaos that's gone on there because they've not been able to manage the caseload there. I understand. I also appreciate that you admit that there have been few, problems, few loopholes that you are now trying to plug. I am completely out of time. So, Mr. Sriram and Paul Marks, thank you so much for joining us on the conversation. We continue to keep a very close track of what's happening in Telangana. Viewers, the big state of Maharashtra is left, and there are a lot of changes and very interesting numbers that we have for you. But I have to take a very short break right now. On the other side, we're going to get you the numbers for the state of Maharashtra. Stay with me. viewers, we're going to bring you the numbers for Maharashtra now as part of the India Outbreak Report. And what we are looking at is that while Mumbai seems to be getting a grip on its battle and the worst may be over for Mumbai, for the surrounding areas it's not. And Thane is now giving tough competition to the main city of Mumbai. The problem and the challenge for Pune continues. If I had to give you the big takeaways for Maharashtra and its projections, well, the Mumbai metropolitan region is the one that's surpassing Mumbai in active cases now. The doubling rate has risen, which is a good sign that at least it's taking us longer to see our cases double. Pune and Thane are key concern areas even now, while Mumbai shows a bit of an improvement. But the peak date for both Mumbai and for the state of Maharashtra has been pushed forward. So now Maharashtra is only going to see its peak, its highest number of cases by 1st of August at about 1.43 lakh cases at that point of time. On the other hand, Mumbai, it seems, may have seen its worst already. Quick conversation here. Let's get in our experts from our political parties. Mr. Clyde Crasto, spokesperson for the NCP, and Aarti Sathe of the BJP. Clyde, it seems we just focus all of our energies on Mumbai and forgot about the rest of Maharashtra, especially the satellite cities around Mumbai.
Well, it's not like that. It's not that, the only concentration was on Mumbai and there was no concentration on. The concentration is in the whole of Maharashtra. We've been working on the whole of Maharashtra, and if you look at the cases around, I agree with you, Mumbai has shown a better rate of improvement, but also around Maharashtra, yes, I understand, the satellite cities like Thane, Navi Mumbai, there have been cases that have been coming out, but you have to understand that the government has been working on all those aspects, and everywhere, if you really look at that, though the cases have come up a little bit, but also the recovery rates are much, much higher. The recovery rates, even in the whole of Maharashtra, the average recovery rate is about 55%. So the recovery rate has gone up, and like you said, Mumbai signs are really good, 68% recovery in Mumbai, 45 days, doubling. The growth rate is only 1.54. So the way things have happened in Mumbai is surely will happen around Maharashtra, every city in Maharashtra. So we are working on it. Rest be assured that things will definitely improve, and they are improving day by day. Certain things have changed. We have worked on more of the modular hospitals. Like a lot of the modular hospitals that have come up in Mumbai, there are people coming from Thane, Navi Mumbai, and they've been recuperating in these hospitals. Here, the treatments are going on in these hospitals here. So things will definitely improve, and in the days to come, you'll see a lot of changes.
Aarti Sathe, where do you think we went wrong? Mumbai, we've managed to, get a grip on it, even though it was such a big challenge, and perhaps the city which was on top of the charts for the longest time. But Thane and the other parts of the Mumbai metropolitan region are actually now showing similar signs.
Well, your figures as far as Mumbai is concerned are pretty heartening. But at the same time, I just would like to put in a word of caution that, it will be a very happy situation if this continues in Mumbai and Mumbai keeps showing lesser and lesser cases. But at the same time, one will have to be also watchful and mindful if number of tests which are being conducted in Mumbai are almost same as they were being conducted earlier. And if there is no ramping up of tests, then that may give a bit of a distorted figure or may not really give the true figures and will show that Mumbai has only plateaued. But if that is not the case, and if Mumbai's doubling rate has indeed gone up and Mumbai is reporting lesser number of cases, I think that's a very heartening sign. On the other hand, as far as the regions in and around Mumbai are concerned, I think there is a bit of apathy insofar as the government and the various hospitals which are working. In fact, the recent apathy which came to notice is in one of the hospitals in Thane, where two patients, one was, I think, first declared dead, and thereafter the family got the body of some other patient and then was told that their father was alive. And then thereafter, when the son-in-law went into the hospital for about more than 5 hours wearing a PPE kit, he discovered that his father had died, and the bodies really got exchanged. So this kind of apathy, this kind of mismanagement, I think that is really causing cases in the MMR region to go up. So I think the government really needs to pull up their socks. Otherwise, the effort of the last 4 months of the citizens, the government, and everybody, even the opposition, which is constantly trying to keep a watchful eye. In fact, all our leaders are out there on the field, including Mr. Fadnavis, who is constantly monitoring the situation, will all go in waste if there is no coordination between the various authorities like the police, the BMC insofar as Mumbai is concerned, TMC in Thane, or Kalyan Dombivli Corporation. So I think everybody needs to work in tandem, and then only can this pandemic and this entire situation come under control.
Okay, I am completely out of time, but we're going to continue this conversation in the coming few days. These are just the basic projections that we've put out. Viewers, and I'm going to thank Clyde and Aarti Sate at this point of time for joining us. Viewers, there's only one thing I want to say. This has been an exercise that Miranao has done for the past 3 months. And the one trend that we have witnessed is that the minute we start taking coronavirus for granted, the situation worsens. The minute we let our guard down, the situation worsens. This is not about saying that we need to be in a state of lockdown for the next 1 year. But it is to say that you cannot let your guard down. When you step out, you need to take your precautions. Public events, mass gatherings, this cannot be allowed. Netas violating rules cannot be allowed. Even if the markets are open, we cannot start crowding. These are the precautions we have to take. The authorities cannot stand by as mute spectators as lockdown norms or even social distancing norms are broken. And the governments cannot stop working on building the healthcare infrastructure, on vaccine, on ensuring that the drugs that have been approved are available for everybody, or ensuring that they keep streamlining the process of bed allocation and hospital allocation and even the medicine allocation. All of that cannot stop. The minute you start taking this pandemic for granted, the minute you start thinking it's okay for you to go back to your normal life before March 2020, you will see a surge in cases. Be prepared for that. Thank you so much for joining us on this big special broadcast we got for you.